So welcome to our monthly housing topical webinar. These monthly topicals are put together based on what our trainers hear from direct service staff and stakeholders on what you're interested in learning more about. And we try to get that information to you monthly in the form of a webinar like this one. Our training team will begin the process of putting together next year's monthly topicals soon, so please feel free to give us suggestions at any time. Now getting to today's topic, anyone who is working in direct service has, I'm sure, worked with clients who have some form of dementia, and that's what our topical today is going to discuss. We're going to talk about recognizing the signs of dementia, some communication strategies, the importance of early diagnosis, and reducing the stigma around dementia. I'm so excited to introduce our speaker today, Tara Hill Matthews. She is the Dementia Resource Catalyst at Aging and Long-Term Care of Eastern Washington, which is the area agency on aging for Public Service Area 11, covering Spokane, Ferry, Stevens, Pend Oreille, and Whitman counties. And go ahead, Tara, the floor is yours.
All right, awesome. Thank you, Anessa. Thank you so much for having me, and thanks for being here in this webinar today. If you haven't met Anessa yet, you should meet her. She is fantastic. She used to work at Aging and Long-Term Care of Eastern Washington, as you might know, and I'm only a little bit bitter that you stole her from us. So, all right. It feels weird to be the only one on camera. I feel like the spotlight is on. All right, I want to start out by, I'm going to share my screen in a second, but I want to start out by kind of getting a feel for who is here today. So here's what I want you to do. I'm not going to have everyone introduce yourself. Don't worry. I'm not going to make you go on camera. But here's what I do want you to do. So I'm going to put a statement in the chat and I'll read it too. And if you agree with it, you're going to put a 10. And if you disagree with it, you're going to put a 1. And if you're somewhere in the middle, you'll choose the number that best fits. Make sense? Any questions? All right, here we go. The first statement is that I can't survive without coffee. So if that's true, if you can't survive without coffee, you're gonna put a 10. If you're like me and you don't really care about coffee, then you'll put a 1. Okay, coffee is a divider. I'm seeing all 1s and 10s except for a couple of people. All right, I didn't realize it would be so divisive already. Yeah, those of you who put a 10, what's your favorite place to get coffee? Okay, making it at home. Fancy cold brew. Yeah, that work Keurig is important, right? Okay. We have some coffee connoisseurs here. All right, here's the second statement. I am currently reading or watching or playing something really great, something I'm really enjoying. Okay, and you know my follow-up question is gonna be, what is it? This is only a little selfish. I want some, I'm not shamelessly getting recommendations or anything. Okay, Wheel of Time. Yeah, Keisha, I hope I'm saying your name right. I'm with you there. Love Wheel of Time. Got some football. Hoover books? I don't know what that is. Might have to explain that one. Chanel, Anessa, Strange Planet. Are you watching the show?
Yeah, it's really
Reading?
good. Highly recommend.
I love the comics. Okay. Handmaid's Tale. Internal Family Systems, Two Dots. I don't know what those are. I feel out of the loop. Oh, okay. Yeah, thanks for explaining, Chanel. Some romance. Marvelous Miss Maisel. Yeah. I was watching that too, and then I had to stop because it got too uncomfortable. Yeah. All right, here's the next one. Next one is I work directly with clients on a daily basis. Oh, you're way ahead of me. Okay. And sorry, I didn't see yours, Miranda and Jackie. Chicago Med, Yellow Jackets and Criminal Minds. Yeah. Wilderness and Flatmate. Okay. Thank you. I'm making a list. Okay, this is everyone. It sounds like most people are working with clients on a daily basis. Okay. All right. Thanks for explaining. And then last one, I know a lot about dementia. Just want to get a feel for where you're at before I start so I don't spend too much time on the basics. Okay, so some variety. Yeah. Some ones and twos and threes. Also some fives. Ellen and Keisha are experts, it looks like, and Thomas. Okay, awesome. Yeah, thanks for doing that. All right, I am going to share my screen now and we will get started. All right. I shared the PowerPoint. I should probably share my screen too, or else that will do no good. All right. So you're seeing my slide, right?
I can see it, yes.
Okay, cool. Thanks. All right. All right, so like Anessa said, I am the Dementia Resource Catalyst at Aging and Long-Term Care. I know that's kind of a weird job title, but what it means is that I do dementia training. So typically for professionals like you, also sometimes for people in faith communities and other businesses, things like that. My goal in my role is three things. So first is to connect people to resources. The second thing is to reduce the stigma around dementia. And the third is really pretty related to that, which is to encourage people to get diagnosed early. And the reason that those two things are linked is because of the stigma around dementia, a lot of people don't want to be diagnosed because they feel like it will make them less independent, when actually the reverse is almost always true. Usually if someone gets a diagnosis early, they can live more independently. So the reason I tell you all of that is just because those are kind of the things we're going to be talking about today. We will be talking about defining dementia and Alzheimer's disease. So that's a question I get a lot. What is the difference between dementia and Alzheimer's? So we're going to talk about that. We're also going to talk about distinguishing the warning signs from normal aging. So I think this is kind of something that scares a lot of people. Just, you know, is my memory loss dementia, or is it just part of normal aging? Small things like forgetting names or forgetting how to spell words, things like that. We'll talk about how to start a conversation with someone who you think might be showing some of the signs. We'll talk about why early detection is important. We'll talk real quick about kind of the processes that medical providers use to diagnose dementia and some risk factors that could reduce the risk of dementia. And then we'll spend more time on resources and communicating with people living with dementia as well. I will share this presentation. I just shared it with Vanessa, actually. And so throughout, I tried to put resources in each slide. So if you know, yeah, Thomas, Yeah, you will get a copy of the slides. I sent them to Anessa. So throughout the presentation, I have this symbol right here, just the little books. That means that there's a link that is related to the topic. So if you remember a slide that you want more information about, you can get more information that way. And I put all the resources at the end too. So we'll talk about some Washington specific resources as well. All right. So before we get into the good stuff, I do want to talk about the Dementia Action Collaborative. What this is a group of people who are working to make dementia resources more accessible to people in Washington. So their goal, and it's made up of people from 3 different agencies. So the HCA, sorry, the Healthcare Authority, the Department of Health, and then the Aging and Long-Term Support Administration are all part of the DAC. And they're working currently on a new state plan that will be published a little bit later this year, and housing is included in those recommendations. So, and their role is just to keep the work moving forward and respond to legislation and foster partnerships. So if you want more information, there is this QR code that you can use. I'll give you just a second to get there if you want to. And like I said, so we're going to talk more about them later. And the reason for that is that they have a lot of resources that are really good for dementia. So we're going to talk about those resources specifically later. But if you want more information about the group that creates them, you can use that QR code. All right. So why are we talking about this? Why is this important? Like I said a little bit earlier, early detection is really important. And we'll talk more about why that is. But that's one of the main reasons we're doing this, is because you are interacting with clients on a daily basis, it sounds like. And if you see anyone who might be exhibiting the signs, it's important to try to get them to a doctor to get an early diagnosis. We also want to reduce the barriers to diagnosis and to treatment. What are some of the barriers that you think might be there? What are some of the barriers to getting a diagnosis that you might see? Or that you think? It could be a theory. Yeah. Yeah, Anessa and Ellen are kind of thinking along the same lines there, limited access to healthcare and waiting to see a neurologist. Yeah, Tate, you're in there too. Yeah, Miranda, that's a big one, being scared to go to the doctor. And Jean, kind of related, is denial. Yeah, Miranda and Jean and Thomas and Keisha, you're kind of all thinking along the same lines too. So a lot of people just don't want to acknowledge it. They don't want to talk about it. They don't want to admit that they might be experiencing some memory loss or other signs. Yeah, exactly. Some of the other barriers that we see, so stigma, I think, kind of encompasses all of that. Also, just not knowing the signs. A lot of times we talk about Alzheimer's disease or dementia, other dementias, as being a memory loss disease, but there are other factors too that go into it that we'll talk about later. Also, not understanding the diagnosis process. So kind of like what Anessa and Ellen were saying, like not knowing which doctor to go to or who to see is another thing. Also, that fear of losing independence, that's a big deal to a lot of people, which makes sense. Another is post-COVID isolation. I think there's still some of that. You're probably seeing some of that lack of access that we talked about. And then transportation too. So transportation to the doctor as well can be a stigma, especially in rural communities. Whoa, whoa. At the start of every presentation I do, I include, I think a lot of people's minds go straight to the later stages of dementia when they hear that word. So like my mind often goes to my grandfather, who was in long-term care at the end of his life. And there are a lot of steps before those later stages, before forgetting your family's names or ending in a long-term care facility. There are often a lot of steps before you get to that point. So could I have someone unmute and read this? Because I am sick of hearing myself talk.
Chickens. We have learned to live with our memory loss and still have productive lives with family and friends. We would like to give you hope that you can live a full life. There will be obstacles to come, but you have an opportunity to give back to your community and yourself and to experience beauty, happiness, and kindness from those people below.
Yeah, you don't have to read all their names. Thank you. Thanks for not being a chicken. Yeah, exactly. So this is from people who are living with dementia to other people who are just getting diagnoses or are starting to see these signs in themselves. And the reason I share this is, again, just because you heard it from them. You can live a productive life and a fulfilling life even with a diagnosis of dementia. All right, so I want to level set about the words that I'm going to use through this presentation. The first is a person living with dementia or people living with dementia, and that's obviously someone who has been diagnosed or who is experiencing the signs of dementia. I usually use the word care partner or sometimes caregiver for a person who's helping someone with their activities of daily living who has dementia. Alzheimer's disease is a type of dementia that affects memory, thinking, and behavior, which we'll talk about. And then younger onset dementia is any dementia that happens before age 65. We're not going to use words like demented or dementing illness, affliction, victim, or sufferer, slang expressions like not all there, or the burden of caring. Why would we not use words like this?
Demeaning,
Yeah, what do you mean by that, Thomas?
making somebody feel less than anybody else, I guess. Kind of, in a way, not bullying really, but just kind of embarrassing to that person.
Yeah, demented is not the nicest word, right? It's pretty negative. I think the one that I hear most often in what I do is are these slang expressions. So not all there, or uh, not working with a full box of crayons. That's one that I heard recently. Something like that. That's pretty offensive. That's pretty rude. Yeah. I feel like I'm preaching to the choir a little bit. I think that you probably already know that, but I just want to make sure that we're all on the same page there. All right, so here are a bunch of definitions of dementia. I'm not going to read all of them, but I just want you to take a look at them and notice what are some similarities between these definitions. Or what stands out to you. That's okay too. So either in the chat box or unmuting, what is similar about these definitions? Sorry, you need time to read them. That's what's going on. I'll be quiet. Yeah, Anessa, that's true, right? Memory is included in all of them. So we've got remember, memory, memory over here, memory. Yeah, Jacob, what do you mean by that? That they're somewhat open or vague?
Some of them just say, a general term and then list off, several symptoms and, a few of them say other thinking abilities or, stuff like that. So it's kind of open to interpretation almost.
Yeah. Yeah, that's a good point. There are a lot of diseases that are part of dementia. So dementia is kind of an umbrella term, and we're going to talk more about this later. But dementia is kind of it. Alzheimer's disease is a type of dementia, so is vascular dementia. So dementia is kind of the general word. Yeah. Yeah, daily activity. Ellen and Thomas, you both noticed that. So everyday activities, daily life over here. Yeah. Anything that's surprising about any of these definitions? Okay. No, not surprising. Yeah, one thing I want to point out too is that it's not just memory in these definitions. So it's also mood changes or personality changes, problems with problem solving or thinking abilities. Language is a big one. Yeah, so memory, but also can be a lot of other symptoms as well. And then, like Thomas and Ellen said, yeah, it's if it affects everyday life, that's when you want to probably talk to a doctor. All right. So here's the answer to the first question. What's the difference between Alzheimer's disease and dementia? So like I said, dementia is kind of the umbrella term. It's the category of disease. And then the diseases that are types of dementia are vascular dementia, dementia with Lewy bodies, frontotemporal, and then Alzheimer's disease. Mixed dementia it just describes a couple of different dementias at the same time, two or more dementias at the same time. So you could have Alzheimer's disease and then have a stroke and also have vascular dementia, for example. So it's just two at once. I want to point out that frontotemporal dementia, or FTD, tends to occur in people who are younger than 60. So this might be one that you see most frequently. And people with frontotemporal dementia tend to have more personality changes than other dementias. So dementia is not another word for Alzheimer's. It's also not a death sentence. So I know a lot of people get that diagnosis and it's pretty scary, but it's not a death sentence. It's also not a normal part of aging. So I think a lot of people assume that they are going to get dementia. I hear people say all the time, like I have dementia on both sides of my family, so I am definitely going to get dementia. And it's not a normal part of aging, and it's not something that happens to everyone, even if it happens in your family. It's also not a specific disease. You probably won't get diagnosed with dementia. You'll get diagnosed with something like vascular dementia or frontotemporal dementia. And then it's also not a mental health diagnosis. It's a medical issue in the brain, but it does affect your mental health, and it can be affected by your mental health as well. So kind of both sides. I want to show you kind of the statistics in Washington State. So these are hot off the press. No one has seen these yet. You're the first. So as you can see, this is the population by year. So 2020, and then the forecast for 2030 and 2040. And this is probably no surprise, but this category here of people who are aged 75 and above it's expected to grow very quickly. So right now, or in 2020, it was at 7%. In 2030, it's forecasted to be at 10% of the total population. And then in 2040, it'll be 12%. And I want you to take a look at this line right here, the last line. that one is really growing the most, and that is I think it's 85 and above. So that number is expected to grow. And that's good news, right? It's good news that our population is living longer, but it will increase quite a bit. Also, so this is the graph actual population of 2018 of people who are people in each age category who have dementia. So it's about 3% when you're 65 to 69, all the way up to 33% when you're 85 and above. Age is the biggest risk factor for dementia. So nothing else comes close to age in terms of being a risk factor. Again, I don't want to imply that dementia is a normal part of aging. It's not. You can see even in the 85 plus category, it's only about a third of the population who has it, not a majority by any means. But your likelihood to get it increases as you age. And then this graph is kind of a combination of the two that we just looked at. So this is a forecast of the population. And then you can see that it's expected to more than double by 2040, the number of people who are living with dementia. This isn't meant to be scary. This is not a doom statistic situation. The only thing that I'm really trying to communicate with this is that you're probably going to see people living with dementia more and more frequently as time goes on. I also want to point out that care partners are also affected. So even though, like in 2020, the actual number of people living with dementia who are 85 and above is about 46,000, there are currently about 213,000 people in Washington who are unpaid caregivers. So it's not just the people living with dementia who will be increasing, it will be the people who are taking care of them and unpaid. All right, any questions about that before we move on to resources? Or comments? Or outbursts? Okay, we'll keep going then. All right, I just want to give you some resources that you can use if you run into a client who might have dementia or who might be showing the signs that we'll talk about later. And this is a list of them. We're not going to go through all of them, don't worry. But I want to point out some that I think could be really useful. So the first one are just some general resources. So we have this resource that I'll show you, just the main dementia page. And the Department of Health also has an excellent page about dementia as well. Here are a bunch of dementia-friendly homes resources. I'm going to show you one, but there are a bunch for developing a safe home and ensuring that a home is safe. Tate, that's a good question. Sorry, I'm not sure I connected that. So the reason that we'll see dementia more and more in the future is simply because the population is aging. So the reason that we're expecting to see more is because we're going to see more people who are older than 85, and dementia is most likely in people who are older than 85. Does that make sense? Yeah, of course. All right, here are also some legal resources and some caregiver resources. I just kind of threw those in there because I assume that you probably run into kind of questions or maybe problems from clients who that are maybe kind of in this category. All right, so like I said, I'm just going to go through a couple of resources quickly. I just want to show you what's out there so that you have access to it. Oops, I'm too excited. So the first one I want to talk about is, this is just the resources from the Dementia Action Collaborative that we talked about at the beginning. there are a couple of really good ones. So the Dementia Roadmap, there's a tiny thumbnail right there. This is really useful for people who are just starting a diagnosis. So it tells you two things. It tells you what to expect in someone living with dementia, and it also tells you kind of the steps that you should take at every stage of the disease. So that's the first thing. There's also a legal planning toolkit. So if anyone has questions about like if they should get a power of attorney or how that works, how to set up their advanced care directives, things like that are in here as well. This also has a really good section of tip sheets. So there's a tip sheet for dealing with anxiety. There's one specifically for home safety. There are a bunch of others too that give detailed and practical suggestions. This is a really good resource. It's from the Alzheimer's Foundation of America, and it goes through step by step, room by room in a home, and gives you some ideas for how to make a home more dementia friendly. So you can see things like a door lock that maybe uses either a key or a passcode, a lever style door handle instead of one that you have to twist. So just things like that goes room by room in a house. Oh, I got ahead of myself. So dementia legal planning, again, this is for powers of attorney and healthcare directives. There's something in Washington specifically called the Dementia Directive, and that can be filled out by someone who may already have a diagnosis, whereas the other two can't. Again, just want you to know that these exist. Oh, and I got ahead of myself again. So yeah, again, that dementia roadmap, does anyone remember what it's for? All right, no worries. So it tells you two things. It tells you what to expect in each stage of dementia, and then it gives you some resources and steps during each stage. All right, so now we're gonna go over the warning signs. As we talk about warning signs, I just want you to know that these are not a diagnosis. So if you see these in anyone or even maybe in yourself, don't use them as a diagnosis. Also, a lot of these warning signs could be symptoms of other diseases. So it may not be dementia. And also, not all signs need to be present to be concerned. So if one or more of these apply to someone that you know, it might be a good idea to see a doctor. All right. I'm gonna tell you another statement. And again, I want you to put in the chat 1 through 10, 10 if you agree, 1 if you disagree. My eyes are super glazed over right now. That's the statement. So my eyes are super glazed over. Okay, thanks, Ron. You can be honest though. Okay, okay, thanks. All right, so number 1 is memory loss that disrupts daily life. So the important part of this statement is disrupts daily life. And this is one of the most common signs of Alzheimer's, right? It's the one that everyone knows, kind of the go-to. And it's not something like forgetting someone's name, maybe an acquaintance that you just met, or temporarily not remembering a word that you want to use. But it could be concerning if someone starts to forget important dates or events, if they ask the same question over and over again, and if they have to rely on memory aids more than they used to. So an example of that would be like having to have Post-its everywhere to remember appointments and things like that, or daily tasks. As we go through these, I'm going to put a typical age-related change because just in the same way that our knees change as we get older, or our hearing changes as we get older, our mind also changes a little bit. So some things are typical age-related changes. And so in each of these, I'm going to put one of those as well. So in terms of memory, maybe forgetting appointments more frequently would be a typical age-related change, or forgetting information that you just learned could be a typical age-related change. But if you remember it later, then it's probably not dementia. Another thing is a challenge in planning or solving problems. So this could be something like finding it more difficult to work with numbers or develop a plan to carry out a larger task. So something like if you're at the store with someone and sorry, hang on a second. My voice is still waking up, you know? So if you're at the store with someone and the total is less than $5 and they hand them two $20 bills, you know, something like that could be a sign of this. Also, difficulty concentrating and taking longer to complete tasks. But a typical age-related change might be occasionally making errors when balancing a checkbook. All right, number 3 is difficulty completing familiar tasks. So this would be something that you've done a bunch of times. So people who might have dementia might have trouble driving to a familiar location, organizing a grocery list, remembering the rules of a favorite game. So these are things that are familiar to you, that you maybe do every day, that you're familiar with. A typical age-related change could be like needing help to change the settings on the microwave, or recording a television show, like something like setting the clock maybe in your car or something. Even though you do it regularly, you don't do it like on a daily basis or a weekly basis, if that makes sense. Like I still have to even though I do it every 6 months, I still have to remind myself where the button is to change the time. Thomas, why uh-oh?
You said messing up your checkbook. I keep my checkbook on the computer and I still mess it up.
Oh, yeah, no, that makes sense. So the checkbook was kind of a typical change. So yeah, I'm with you. Math is not my strong suit, I'll be honest with you. Fourth sign is confusion with time or place. Any theories what this might be? Or any examples of this that you might have seen? So what could be an example of confusion with time or place? Yeah, Shannon, exactly. Yeah, being not sure where you are or what year it is, maybe not being sure how you got there. Yeah. Also, having trouble understanding something in the future, that could be a sign. Yeah, forgetting where you are or how you got there, forgetting your age. Yeah, Jean. That's kind of that and wandering that Anessa said, they're kind of both in the later stages. But yeah, some of the beginning ones would be forgetting where you are or having trouble understanding something in the future. Something that's a typical age-related change is getting confused about which day of the week it is, or what the date is, and then remembering it later or being able to figure it out. So like the date, I forget it all the time. I always have to look at my phone for that. That would not be concerning. It would not be a sign of dementia. All right, halfway through, trouble understanding visual images and spatial relationships. This is something that is a really important part of dementia. So it could be a vision thing. So it could be like losing your balance, not really balancing too well, maybe tripping a little bit more often, falling more often. It could also be trouble reading. So that the visual problem there. And then problems judging distance and determining color or contrast. And that could show up in things like driving or even just walking. So someone who might starting to be seeing the signs of dementia might start running into things more often because they have trouble judging that distance. And part of that is that dementia can impact that part of your brain, which is why it can be a sign of dementia. So something that is just a typical change is vision changes that are related to cataracts or even just to getting older. Language is a big part of dementia. So new problems with words in speaking or in writing. This can show up in conversation or in written form. So it could be something like, it's usually not, so forgetting words can be pretty common. It's usually more than that. It's usually like having to stop a conversation because you don't know how to continue it. Struggling with vocabulary or having trouble naming something familiar. So an example would be calling a watch a hand clock. Another thing is repeating themselves. So if they say something and then 5 minutes later they say the exact same thing, that could be a sign of dementia as well. A typical age-related change is just having trouble finding the right word or forgetting a word and then remembering it. Okay, yeah, Ellen said that your mom repeats herself in texting. Yeah, interesting. So that would probably be concerning to me. I'd probably be encouraging her to go to a doctor unless she already has done that. All right, next sign is misplacing things and losing the ability to retrace steps. So the operative part of this is losing the ability to retrace steps. That's the important part. So they might put things in unusual places, and that's not too abnormal, right? Like the other day, I just put my keys in the freezer. So something like that is not unusual. What is unusual is losing things and being unable to go back through the steps to find them. So like if you're trying to help someone find something, what's the first thing that you tell them? It's always like, where did you last have it, right? If they have trouble going back through that process and like, or if they find the object and then they can't remember how it got there, then that might be a cause for concern. Okay, thanks, Ellen. Thanks for explaining that. They also might accuse others of stealing because if they can't retrace their steps, they are not sure how it got there. So they might start accusing people of stealing, which can show up in the later stages as well. It is typical to misplace things from time to time, like a pair of glasses or the remote, and then retrace your steps to find those things. All right. Moving on, number 8 is decreased or poor judgment. So this can look like maybe giving money to telemarketers or scammers, unfortunately. It can be choosing to buy something that they may not need or buying multiple of one item. I know that my grandmother, when we cleaned out her house, she had like a whole bin of scissors. She just kept buying scissors because she couldn't find them. or because she just liked them. So something like that, buying the same thing over and over, or making poor decisions. This can also show up as paying less attention to grooming or keeping yourself clean. But a typical age-related change is making a bad decision once in a while. An example of that might be neglecting to change the oil in the car. Number 9 is withdrawing from work or from social activities. And this comes back to what we were talking about earlier, that pride and maybe some not wanting people to know that they might be experiencing these changes. So this usually looks like withdrawing from hobbies or social activities or work, even sports, things that they usually do, withdrawing from those. It can also be having trouble keeping up with a favorite activity. So maybe they follow a certain team. They usually like know everyone on the team, and they know exactly who they're playing at any given time, and maybe they can't do that anymore. And again, avoiding social activities can be because of the changes that they're experiencing. So you don't want your family to realize that you might be experiencing memory loss or something like that, and so you avoid them so that they don't see it. It's typical to feel uninterested in family or social engagements, though. Just not wanting to go to a family event or an event with your friends is not a sign of dementia. All right, and last one is changes in mood and personality. This can happen with any dementia, but like I said, this is most common with frontotemporal dementia because of where it affects your brain. So this could be something like becoming confused or suspicious or depressed or anxious. It could also look like getting upset or having lower social inhibitions. So maybe undressing in public can be something, or talking about something that is not appropriate, that they normally wouldn't talk about. It is typical to have really specific ways of doing things, though, and to become irritable when a routine is disrupted. All right, time for a pop quiz. How many do you remember? So either unmute yourself and tell me your warning sign, or put it in the chat. Does not have to be word for word, just the basic idea. Yeah, confusion with time or place. You know what? I thought I was really smart and knew where each of these was, but I don't. So it's going to be, I think, confusion with time and place is right here. No. Oh man, I outsmarted myself. Okay, that's okay. We're gonna go with it. So yeah, confusion with time or place, mood and personality changes. I know that was the last one. Yeah. Retracing steps. Yeah, being unable to retrace steps, right? Ha. Don't remember, that's okay. No problem. Yeah, repeating. So that's often the memory loss that disrupts daily life. Yeah, difficulty completing familiar tasks. I think that is number 3. Yeah. Yeah, I gave you one for free, challenges in planning or solving problems, and we did not find the first one. Confusion with time or place. Yeah. All right. What else? Got most of them. Yeah, problems with speaking or writing. Good. Yeah, speaking or writing, I think is, nope. Well, there's another one. Withdrawal from social activities. Oh, decreased or poor judgment. It's going to be the last one I click. There it is. New problems with words and speaking or writing. Yeah, Miranda, exactly. and trouble understanding images or spatial relationships is the last one. Yeah, good job. You got this. I'm going to be honest, I think that's the fastest I've ever seen a group do that. And I did give you a couple, but I still think it would have been fastest. All right. We're kind of running out of time, so I think I'm going to, yeah, let's go ahead and play this video. It's a short one. I don't think I shared my video correctly, so hang on just 1 second. Oop, let's go into my video. I don't know why I was doing that. Okay. Okay. All right, can you hear the soft, pleasant music?
Again, good morning. Welcome to our webinar.
All right. Sorry about that. We're not going to get into the webinar. All right. So I hope that helped too, kind of understand what the difference is between normal aging and memory loss that might be related to dementia. I just want to reiterate that you're looking for changes in someone's behavior. So like, for example, I'm terrible at directions. Like I really struggle. It's embarrassing how often I have to map back to my house, for example, or to work. If I'm in an unfamiliar place, I often have to map back there. I can't keep directions in my head, and it's very like I can't really tell you where north and south is. I'm one of those people. My dad though is great at directions. Like I'm pretty sure that he could get from his house in Idaho Falls 7 hours to my house without even consulting a map the whole way. He always knows where he is. So I would be concerned if I see changes in him. If he doesn't know where he is, I would be less concerned about me because I never know where I am. So I hope that makes sense. You're looking for changes in someone. And then again, some changes are a normal part of aging, but memory loss or any other sign that starts interfering with your daily life, that's when you should be concerned. And warning signs also look different in everyone. So just because someone's not experiencing one of the signs doesn't mean that they may not have dementia or be concerned. I said that weird. Just because they don't have all the signs or a sign might look a little bit different doesn't mean that they shouldn't talk to their doctor. All right, any questions about the warning signs? Or about anything that we've talked about so far? Okay. All right, then I'm going to give you a choice. Are you ready? We've only got about half an hour left, and I want to make sure that we have time for questions if you have them at the end. So would you rather talk about risk factors? So factors that could reduce the risk of dementia? Three choices: risk factors, or talk about the diagnosis process, or talk about how to start a conversation with someone who you think might have dementia. So the options are risk factors, how to start a conversation. So, sorry, let me give them the right order. Risk factors, the diagnosis process, or how to start a conversation. Okay. Okay. I think the risk factors have it. Okay. Yeah, we can definitely do that. So we're going to skip this part. The one thing I will say about a conversation, since a lot of people were asking about this, and again, you're getting the slides too, so you'll have this information, but the one thing that I would say is don't talk at them. It should be a conversation. You want to listen to them. That's probably the most important thing. All right. Before we talk about risk reduction, I do want to talk about early detection and why it's so important. So we've talked about some of these things just briefly, but the reason that early detection is so important is because there are medical reasons it's important, and there are also kind of emotional, financial reasons that they're important. So the first reason that it's important to get diagnosed early if you have dementia is that you'll have more access to resources. So your local area agency on aging, like where I work, is a good place for resources. The Dementia Action Collaborative that we talked about earlier. There are a ton of free resources for people who are living with dementia. The second reason is that it's easier to identify or treat or reverse conditions even. A lot of the a lot of the signs that we just talked about could belong to another disease instead of dementia, like a UTI, for example, or a vitamin deficiency, or a medication that they're on. Those could all create signs that look like dementia. So if they're able to reverse something just easily like that, that's another reason that it's important to see a doctor early. Also, seeing a doctor early gives you the chance to make lifestyle changes. So you're going to see when we talk about risk factors that there are a lot of things that we can do to reduce the risk of dementia. And it gives you some time to do that, to try to slow the symptoms of dementia. It also lets you get support and guidance from organizations like AAA's that we were talking about. Also the free legal resource that we talked about earlier as well. And it also kind of lets you be able to tell your family and your friends what you want to have happen throughout the disease. So you can make decisions with them about things like how they should handle a situation where you can't think of the right word, to what you want your life to look like at the end of it, or where you want to be living during dementia, or how to start the conversation of driving. So all of those things, not just powers of attorney and wills and things like that, but also how you want your family and friends to treat you and to react during the disease. Can I have somebody else read a quote? Someone who's not Thomas?
You just want the one at the bottom there?
Yeah, please.
Okay. If we could have had a correct diagnosis for my wife, even 2 years earlier, it would have given us more time to plan and to accomplish things we always wanted to do. J. Smith.
Yeah, thank you. A lot of people I talk to say that they wish that they had gotten a diagnosis earlier. And a lot of things I read say the same thing. Like, it's kind of across the board. A lot of people wish that they had gotten a diagnosis earlier. All right, we are skipping right through the diagnosis process. Here are some questions that they could bring with them if they want to. But we're going to go to risk reduction. All right, so taking a look at this visual, I know that there are a lot of circles. It's a lot going on. But the thing that I want you to see is that, so we'll talk about each of these things in just a second, but I want to start at the end, actually. So a lot of the things that go into a dementia diagnosis are actually modifiable. So you can see that all of these things, depression and smoking and hearing loss and obesity and hypertension, a lot of those are modifiable. And so they think about 40% of the risk factors for dementia are modifiable, which means that if we all lived perfectly healthy lives and got rid of all of these things, which is impossible, but stay with me here, then we could reduce the number of people, or we could reduce the likelihood of dementia by 40%. So I'm going to say that one more time. 40% of the risk factors that go into a dementia diagnosis are preventable, or potentially modifiable is the better word for that. All right, so these percentages, the bigger circles are more likely to cause dementia, and the smaller circles are less likely. So you can see up here, education is a big one. And even though it's in the early life area, studies have shown that even if you have formal education later in life, that still helps. We're going to talk about some resources for that in just a second, but what I mean is even if you have less education in your early life, having formal education at any point during your life can help reduce the risk of dementia. Hearing loss is another big one, and it looks like smoking comes in third. So hearing loss is related to dementia in a couple of different ways. And it's important to talk to a healthcare professional to manage any hearing loss that you might be experiencing. So hearing loss, there's some evidence that not following conversations kind of leads to you checking out a little bit more, which can lead to dementia showing up more quickly. It's important to avoid depression and social isolation here. And I kind of skimmed past smoking, but stopping smoking is important. And it's not, even if you're a current smoker, if you have not smoked for 9 years, it's like you've never smoked. Your risk is very similar to if you've never smoked. So it's really never too late for that either. There's also physical inactivity is a risk factor, and obesity and hypertension. So one thing to remember is that what's good for your heart is good for your brain. That's kind of with diabetes too. And then alcohol, drinking more than 21 units per week could be a risk factor. I know that this is a lot. And if you're like me, you're thinking of all of the things that you might have that could lead to dementia. That's really not my point here. My point is that you can really always be doing something to reduce the risk of dementia. So I hope that that's hopeful. If you're one of those people who are like me and you have dementia on both sides of your family, a lot of these things can go a long way in either reducing the risk of dementia or delaying the symptoms of dementia. Any questions about that? We'll talk about it a little bit more, but okay. So that's kind of the general risk factors, but I also want to kind of zoom in on Washington a little bit more and show you kind of where we are in terms of those risk factors. So you can see that actually kind of across the board, we are doing better than the national average. National average midlife hypertension is at 40%. We're at 34.7. So, and that's true across the board. If you look at all of these things, smoking is at 11.3%, but it's at 13.4% nationally. So we're doing pretty well as a state, you know? Yeah. But kind of, you can see kind of the things that are most, the biggest risk factors in our state. So physical inactivity is up here at 41.7%. Also relatedly, midlife obesity and midlife hypertension. So reducing those can reduce the risk of dementia. So we've talked about how we can reduce the risk. Now we're going to talk about how to do that. We talked a little bit about traumatic brain injury, and I know that this isn't something that is modifiable after the fact, but prevention is important. So things like falls prevention classes that Anessa can tell you a lot about, and that organizations throughout the state offer can help. Also just kind of things like wearing a seatbelt or using a helmet can help as well. Also, formal education, like I said, it's never too late to get more. Some colleges like Harvard and Stanford and MIT offer free courses, or people can also go to a community college. Also, Get Set Up is really cool. Has anyone heard of Get Set Up? Oh, okay, awesome. Thanks, Rob. Coursera offers free college courses. Tate, unfortunately, yes. TBI can make someone more at risk for dementia. Yeah. Of course, there are other ways that you can reduce your risk if you have a TBI, but yes, a TBI can make someone more at risk. Yeah, I'll have to check that out, Rob. I'll look at it. I just want to, I'm a Get Set Up fan. It's really cool. So I'm gonna spend 2 seconds talking about that. So here's why it's awesome. You can have people use it to get familiar with Zoom. So if you want someone to join a Zoom and they're not familiar with it, there are courses on Zoom and using an iPhone and an iPad, but there are also courses on things like exercise classes and drawing and recipes. So, and it's free for all Washington residents over 50, I think. Yeah, thanks, Rob. Yeah, I'll check that out. So yeah, it's free to anyone in Washington over 50. Okay. Eating healthy is also important. So it reduces a couple of those risk factors like hypertension. And here's one option for that called the MIND diet. There is some evidence that the MIND diet, which looks like this, I won't read it all, but can help with reducing the risk of dementia. Also being physically active, there are a lot of programs for seniors in terms of physical activity, like local senior centers and gyms and community centers might offer courses for seniors. And then you might already know this, but the Washington Department of Health also offers help to quit tobacco for free. I know that was really quick. Really, the most important thing to remember about risk reduction is that what's good for your heart is good for your brain. I think the reason that that is important is because I think we kind of all know what's good for your heart, right? So things like eating a good diet and exercising and taking your prescribed medications, those are all good for your heart and also good for your brain. All right, that was a little speedy. Any questions about risk reduction? Okay. If you have any, let me know. Yeah, thanks for letting me know, Darren. All right, the last thing we're going to talk about is effective communication. So yeah, so this is communicating with someone living with dementia. I think that's the last thing we have time for. All right. And if you have any questions throughout this, just let me know. Don't be afraid to put them in the chat. How you communicate with someone living with dementia really depends on where they are in their dementia journey. The reason I say that is because in later stages, well, in the beginning stages, you might see what we've been talking about. So trouble finding the right word, or trouble remembering what you were going to say, or losing your train of thought, speaking less often, things like that. In the later stages, though, communication might look really different. It might look more like communicating by touch or body language or tone of voice, more than communicating with words. So this is going to be a lot of tips for different stages, and I'll try to identify the stage that we're talking about as we go through them. One really important thing is to avoid quizzing. So it's really tempting to kind of see where someone might be at in terms of their memory and say something like, hey, do you remember what we got when we went to the grocery store? Or do you remember our high school graduation? You know, something like that. You really don't want to do that. It's upsetting to someone living with dementia. Same with correcting. So if someone says something and you disagree with it, you don't want to correct them. Instead, you want to join them in their reality and talk to them that way. Another thing, this might be obvious, but be respectful. So don't exclude someone from conversations. Don't talk to their care partner instead of to them. Talk to them directly instead of talking to someone else about them. Also, one of my personal pet peeves is don't use a baby voice to talk to someone who is older in general, but especially living with dementia. Use a normal voice. They're an adult. Also, you want to be aware of your tone and your body language. Like I said, this is most important near the end of dementia, but it's also important throughout. So just making sure that your tone is calm and that your body language portrays calm, that's important. Especially if you're talking, it can be really tempting to try to get someone's attention by about something important, by being louder or more animated or something like that. Actually, it's kind of the opposite with someone living with dementia. You want to limit any distractions to what you're talking about. You also want to be direct. So if we're talking about decisions, you want to offer choices so that might look like, do you want salad or chicken for dinner instead of what would you like for dinner? And I know that this is kind of the opposite of a lot of probably the training that we've all been through, but you kind of want to leave it closed instead of open. So would you like this or this? Do you want to do this or this? Also, if you're trying to give instructions, being simple about it, get dressed may not be understandable in the later stages, but put your arm through the armhole might be better. So trying to break everything down into smaller steps. A lot of people, especially in the beginning stages, a lot of people ask questions over and over and over again, and that can be really frustrating. But it's important to be kind and compassionate, and to try not to let your frustrations show, and to answer those questions like it's the first time they ask them. You also want to help the person to find the right words. If they pause and they're not sure what the right word is, you can help them to find the word, but you don't want to fill in the blank too quickly. What would happen if you filled in the blank too quickly? Yeah, thanks, Stephanie. For a lot of people, it could be frustrating and upsetting. And Lori, you're right too. They might stop trying to find the right word. And that's not always ideal. Yeah. Also in the later stages, especially, visual prompts can help. So this can look like using pictures to communicate. Again, this is not in the earlier stages. This is more in the later stages. But doing something like putting a picture of a toilet on the bathroom door can help a lot. Something like that that's more visual. All right. Before we get into resources, I do just want to talk about a couple of things that you can consider doing at the end of this presentation. One thing is to become a dementia friend. So a dementia friend is someone who has been through a dementia friend information session and is committed to making life easier for people living with dementia. You can also review the a dementia friendly housing resource. So I put a few at the end of this. You can do that. If you are in a situation where you can do so, you can establish a walking group or a group exercise event or class in your area. Also, if you have vending machines on site, you can think about maybe requesting low sodium or healthy snacks. Also encouraging learning, so that formal education we were talking about earlier, maybe setting up some classes or helping someone get set up. And then you can also connect with the Dementia Action Collaborative. You can look at their website, look at their resources, and see them as well. And then I don't think we really have time for this video, but I encourage you to watch it. It's a great video, and it changed my perspective. Then just at the end, I want to point out the resources that we have. Excuse me. So we've got a few resources for dementia-friendly homes, and here are some general resources with a lot of different resources. There's also legal and caregiver resources. And then I put all of the resources throughout the presentation at the end too, so a lot of these are just national resources as well. All right, and that, my friends, is all she wrote. What questions do you have? Yeah, thanks, Jean. I really appreciate that.
I have a bit of a question on medication.
Okay.
I know that they use like metformin, I think it is, for Alzheimer's or dementia. Is that something that, I mean, I know that's a prescription type thing, but is that something that you would encourage to start earlier? Or do you know any research on that?
I don't, and I want to be upfront and say that I'm not a medical professional. I haven't heard starting metformin earlier. But I can definitely look into it. But again, I'm not a medical professional, so I can't make any recommendations, but I can look into it and see if I can find anything. Cynthia, was that you?
Yeah, thank you. I appreciate it.
Okay, sure. Any other questions?
I have a quick question. I would be curious about timeframes, like starting diet changes and I mean, like probably earlier is better, but if it isn't like you need to be doing this 12 months before it actually starts to really impact and change. Like if somebody's diagnosed a little bit later, is it still beneficial to do these limiting risk factor things?
Mm-hmm. Yeah, so it depends on the risk factor. So the only things that we really have that information about are smoking. So like I said, 9 years. If you haven't smoked for 9 years, then it's like you've never smoked. And I don't want that to be a deterrent to stop smoking. So even later, it can be helpful. I think that it is cut in half if you've stopped for, I'm not 100% sure, so I don't want to say the wrong thing. But even stopping for a while ago, sorry, I went down a rabbit hole. So for diet specifically, they're really the earlier the better. I don't know any data on when to stop, but even like in midlife, eating healthier, changing your diet that's the best time to do it. Did that answer your question? I know it was kind of roundabout.
It did, yeah. I
Okay.
just wonder, so a family gets a diagnosis and they just want to dive into all the, eating the right way, getting on the medications.
Mm-hmm.
Like, are they kind of spinning their wheels? Is there any hope that that's going to really change by the time somebody's
Oh,
been
there
diagnosed?
definitely is hope.
Yeah, okay,
Yes.
right.
Yeah. Yeah, even if they've already gotten a diagnosis, even if it's in maybe a little bit later stage than we would hope, it is helpful to alleviate some of those risk factors, to start the mind puzzles, to start eating a little bit better. Yeah. And I also want to say that in terms of diet too, it's more important to change your diet and exercise than it is to lose weight. There have actually been some studies that weight loss isn't helpful. It's the diet and exercise that's helpful. I hope that makes sense. Stephanie, I know it's been recorded, so Anessa might have to answer the question about getting the recording.
Hey, yeah, we will get the recording converted to a YouTube link, get it put on YouTube, and then we will send out that link and the PowerPoint slides as soon as we can. Usually the turnaround is like a week or two.
Cool, finally, YouTube star. All right, what other questions do you have? Going once. Going twice. Okay. All right, well, thank you again, everyone. I really appreciate you joining today, and thanks for learning a little bit about dementia.
Thank you so much, Tara.
Yeah, thanks,
Yeah, thank
Vanessa.
you.